Hi, everybody. This is Simone Tellini and Gary Whiteson here from POAC Autism Services. And we're here today to talk to all of our first responders and hospital and medical workers who are so valiantly handling the health crisis that we're in right now with COVID-19. And what we wanted to do today is just maybe give you some quick tips about how to address patients with autism when you see them come into your practice or your facility, either for testing or for treatment or even for hospitalization. So we've put together a very brief training for you, just some tips about how to work with our guys when you see them. Gary Whiteson, our executive director, has provided hours and hours and hours of training to thousands of officers, first responders, and hospital workers as well. And so we know that just the sheer numbers of people diagnosed with autism, you will see them in your facilities, you will see them in your practice, you will see them in your testing centers for sure. And the main thing about autism to understand is it is a spectrum disorder. Communication is one of the biggest deficits with autism. And when you see somebody with autism, you've seen one person with autism. And being a spectrum disorder, no two individuals look alike. But what is at the core of autism is the social communication piece. So you may see somebody that has great language skills, and you may assume that they can understand your instructions and what you need them to do, but they may not. You may see somebody with fewer language skills who may actually have a good grasp on what you're asking them to do. And it may seem like they don't. But that's what autism basically looks like. And with autism comes a whole bunch of comorbid situations and other potential medical issues that you should be aware of and understand, because of course that comes into play with COVID-19.
Yeah, there's the vast majority of individuals with autism have comorbid conditions. And a study released last year said 25% of them have 9 or more. The one that most concerns us now is anxiety. 40% of individuals with autism have a diagnosable anxiety disorder. That means they would qualify to be diagnosed with it. And we see, pattern thinking, focusing on a specific thing rather than the big picture, a lot of sensory issues, and the social communication piece that Simone was talking about earlier, not getting the cues, not understanding, what's supposed to happen when. An unstructured time, the time they're laying in the hospital bed, not doing anything, is the worst possible time. So you have high anxiety of the individual as well as the family, family members' anxiety, especially if they're not able to be with their loved one due to health concerns.
Exactly. And so these are some of the things you might expect when you see somebody with autism. Challenging behavior might be an issue. It's not personal. That's the main thing to understand about that. You may see aggression, kicking, biting, throwing things. You may not. It's rare, but it is something that can come up, especially as part of the anxiety piece, which Gary just mentioned.
A lot of sensory
defense.
Yeah.
Go ahead,
sound,
Gary.
texture, odors could be a real issue. We want to get information. We're going to go over that. You may see self-interest behavior, hurting themselves, pinching themselves, head banging, self-induced vomiting, even in extreme cases. The need for routine is critical. And again, realize it's a routine and that it's differences for each child that we're going to see. So some things you could do right now to avoid potential problems. Number one, get as much information as possible from the parent or caregiver. Everything from behavioral triggers. Hey, what's going to set this child or adult with autism off? Always determine what form of communication. Individuals with autism communicate verbally, sign language, pictures, cell phones, iPads. Find out from the caregiver, okay, how does your child communicate? Anytime we can keep waiting to a minimum, do so. As a first responder myself, bringing people into the emergency room, if there's a way we can bypass the queue, if we have an individual with special needs, as long as it doesn't impact anybody else's medical condition, waiting time as possible. Allow them to have comfort objects. cell phones, iPads, whatever their special thing is, but definitely the connection with the outside world is important. I always say autism is almost like another language, and you want to view the parent, the caregiver, as the interpreter to autism. Get the information from them. What do you need? Will this individual hurt themselves or others? Are directions better given from me, the medical provider, or you, the parent? What calms their child down? You know, very often there's something that is particular to that individual that you can use to calm them down. What's worked before for medical visits? It's not going to be the first time they ever went to the doctor. Hopefully it is the first time they've gone to the hospital, but if not, what has worked before? Is there anything that upsets or scares them? Tell us what we need to know. And again, back to the sensory issues, are there any sensory issues? One of my favorite things is My Health Passport. You could, oh, I thought we had a picture. You could download it, just Google My Health Passport. And it's, if the individual's admitted to the hospital, it's a form you fill out. How do they take medicine? Everything you need to know, you put it in the bin outside the door. It just gives that much information, especially for shift changes. It really helps a lot.
So strategies for communication with the individual themselves: use calm, concrete language as much as possible. Use clear sentences when you speak, short, clear sentences, telling them what you want them to do, exactly what you want them to do, and not so much what you don't want them to do. Move slowly to the patient level to communicate. That's been, research has shown that that's really helpful. If you can communicate at their eye level and move slowly to that level, that's going to be really helpful as well. Many individuals with autism do have a processing delay. And I know right now this is kind of a fast-paced world that we're in with what's going on, but it may take them 2 or 3 or 4 seconds to actually process what you're asking. So one question at a time. Obviously use those caregivers and those parents and the people that are coming with them to help you get that information. But when you are asking them a question, you need to give them a little bit of time to process that. And
yeah, I could take this one.
Yeah.
Always tell them what you want them to do, never what you don't want them to do, and be concrete. Hey, I need you to lay flat. I need you to lay still. I need you to scoot your butt up on the bed versus stop acting up. I can't draw what acting up looks like on a piece of paper. It's not concrete. Tell them what you want. Never give an individual with autism a choice if there's not a choice. Hey, are you ready for your x-ray? You want your x-ray? If they have to have the x-ray, don't ask if they want it. You know, as someone who has to listen to a patient's heart, is it okay if I listen to your heart? They may say no, then you have an issue. Give them a choice. You want me to listen to your chest or your back? As long as you're able to do your job, giving them a choice that puts the power in their hand will lower their anxiety level and help them move your job along that much better. Oh, that's the health passport from before, just an example, but there's many other ones that you could download for free, English and Spanish. Other things you can use, a prep box. Many hospitals have a prep box. They're going for a blood draw or IV. There's prep boxes you can have. You can research those, very simple things. Clustering nursing interventions. If you know a lot of people are going to be coming in and checking, can we move them closer together so the anxiety of being interrupted and poked and prodded all throughout the day is reduced. Involve parents. Best case scenario is have the parent there, one parent there. I understand if that's not an option due to COVID-19, if there's any way it could be, best way, but if not, maybe an iPad or iPhone where they could actually watch and see their child and talk and assist you in giving directions. No, Christopher, I need you to do this. It would really, really help. Need for routine, a visual schedule, and sticky pads could be your friend. I've seen many nurses actually lay it out. Okay, we're doing this. And when that's over, allow the individual to crumple up the paper and move on, just so they know what to expect. Let them know what's going to happen. Social stories, which is usually a visual format with words, lets them know. It could be a social story for a blood draw, a hospital stay, being examined by the doctor. And due to COVID-19, there's a ton of social stories out there. Even like Disney and Sesame Street have done a bunch. So a lot of really good resources.
And strategies regarding sensory problems. This is a thing for a lot of us that are used to the sights and smells and sounds of a hospital or an emergency room or a doctor's office. Even those that aren't used to them, those sensory issues may not be a big deal. For somebody with autism, different smells, different sounds, they can be a very big deal, even the calmest of settings. When you add in the fact that this is a more frenetic setting maybe, and certainly something that's unfamiliar to them, sensory issues can really be overwhelming. So it's important to try and take that into account and to limit as much of that sensory overload as possible, either by closing a door, leaving a door open or closed. Sometimes bright lights are troublesome. Obviously, you need brights for somebody who's being examined, but perhaps when somebody's waiting, they don't need the lights on. And these are all things that you'll learn from a caregiver.
Right. And many hospitals that we've worked with have sent weighted blankets for individuals to provide that, weight on them, which tends to calm them down. There's sensory items you can buy, make sure they're safe. Dishwasher, safe. You can wash them with soap and water. Anything that provides that stimulation that the child could work with that and calm down, and all the other issues that Simone said. So inpatient care, assuming the child's there, shift changes. And we know that there's so much of that going on. Let the new staff coming on, okay, let's describe Johnny. This is how Johnny likes this, and he has this, and make sure all of that. And that's where the health passport or some other information will come into play. Always let it be known how to contact the parent. If the parent's not allowed in the room, always have a good contact for them. They may be in the parking lot sitting in their car the whole time, but just know so you know how to do it. Do a needs assessment of the individual. What are their preferences? What motivates them? What could you use as a reward to get them to do the actions that you need them to take for your safety as well as theirs? Guardianship. My son's an adult, but his mother and I are his legal guardians. So you want to understand over 18, there may be guardianship issues, that there may be an outside person, usually the caregiver, that is in charge of all their medical decisions, all of their decisions. You need to know who to ask. And the last one, and this is a big one, while problem behavior is rare, you may experience some problem behavior, especially if the anxiety is high. Evaluate your preparedness if a behavior does occur. Who's going to be present? Will you need more staff? Do you quickly get everything out of the way? Those are all things that you should have in place already, just in case.
And we understand with the situation the way it is right now that not all parents and caregivers can be present in all circumstances, but if it's at all possible, it will be so helpful in the treatment and evaluation of these individuals. If a parent or caregiver can be present or close by, it would just be amazingly helpful for that individual. And it also causes a great deal of anxiety for the families when they think that they can't be there.
So this was extremely brief, as we know time is so valuable. We cannot thank our first responders, the hospital staff, everybody enough for what they're doing for the entire community, not just individuals with special needs, but all of us. Our hearts, our prayers are with you. We just wanted to give you a brief little touch. If you want more information, if you want more in-depth training, you want more resources, we are here for any first responder at all. Just reach out to us at poac.net. The email is info@poac.net, or you can reach us at our phone number 732-785-1099. On behalf of all of us at POAC Autism Service, again, thank you, stay safe, and God bless. Thank you, guys.
Thank you.